Nurse TV, brought to you by HESTA and the Australian Nursing Federation.
Hi, I'm Pat. I'm the remote area nurse here in Mount Liebig in Central Australia, and I've been working here for just a few weeks. I'm new to this community. I've worked in other communities before. Well, we're west of Alice Springs, about 300 kilometres, and we're sort of on the edge of the McDonnell Ranges, the West McDonnell Ranges in Central Australia. We're very close to Mount Liebig. It's very beautiful around here, but very remote. Well, the community is a mainly Aboriginal community. There's somewhere in the region of 300 people living here, although it's a moving feast. People come and go quite a bit, so it's hard to know exactly who's here at any one moment. We do have a population list which we try to keep up to date, but it's a mixture of people ranging from very young to very old. Okay, this is our clinic here at Mount Liebig, and as you'll see, this is the main area where people come and wait. And we have an area here where we weigh the kids, and we've got some promotional material about good foods for children. And then we have a kitchen where it's a bit of a combined effort, this room. It's a kitchen, and we also use it for processing specimens. And this is our store cupboard where we keep all the main stores. Well, as the remote area nurse, I'm also responsible for making sure that the ambulance is properly maintained and serviced, and also to drive it. And we all do a four-wheel drive course for a couple of days to make sure that we're reasonably proficient, because of course we're driving on dirt roads most of the time. And we have a stretcher in here and just oxygen. Basically, that's the basic equipment that we have. Well, we've got a variety of different bags in here. This is a kind of first response bag here, which contains pretty much everything that we might need to treat somebody when we're going through the ABC process. So it's got airways, it's got breathing masks and so on, and it's got circulation stuff, so things to deal with bleeding and with circulation. So that bag, and then it's got a few little extra bits and pieces as well. So that's our first response bag, together with these collars, which really you may very often need, particularly if you've got a motor vehicle accident or something of that sort. Then we've got a bag like this, which is full of all the odd bits and pieces, like we were looking for something to keep the flies off us before, sunscreen, blankets to wrap people in, you know, if they're hypothermic, those sorts of things. She's just said he fell down.
I just wonder whether...
Oh yeah, it's very tender. Could be
He's been
a green
at
stick, do you think?
Yeah, childcare, and he hurt him at childcare.
Well, can he weight bear? Can he walk on it? Let's see, can you walk?
Stand down.
Can he? No, he can't weight bear, can he?
He's not going to.
No, I think he's probably got a fracture. Well, it's a fascinating job. I mean, in the morning, I usually come into the clinic. Well, first of all, I'm on call 24/7. So sometimes I might have been out at night. So in the morning I come in, I try to get all my paperwork sorted, and then 9 o'clock usually people start to come through the door. I get people wanting their medicine boxes filled up. I get people wanting me to deal with boils and sores on their skins. I get people who want me to check their blood pressures and their blood glucoses. I get somebody who's really sick and maybe needs antibiotics. I get people who are suffering from overdose of alcohol, who may need to have additional fluids and IV line put in. I get people who have got trauma, burns, people who might have been stabbed, people who've been assaulted, psychiatric patients. I mean, just you name it, we get it. Just everything walks through this door.